80% of Americans are looking to review their insurance during their last quarter of this year, and you may want to do it as well. Rates are going up. Here to explain is Craig Gussin from the San Diego Association of Health Underwriters. Craig, good morning.
Good morning, Raul.
I am super stressed out. I am every single year at this time. I don't know any of this stuff. When does open enrollment begin, first of all?
Open enrollment begins for people on Medicare. It began October 15th and it ends on December 7th. For the rest of us who have individual plans, open enrollment starts on November 1st and ends the last day of January.
Why is it so complicated?
Why is it so complicated? I guess that's because I have a job. Because it wasn't complicated, everybody would make it easy. They keep changing things on us all the time. So
right.
they try and do things that make the plans better, but it ends up being a lot more complicated than what it should be. I think the big thing is that people need to just review their health insurance,
right.
Make sure the plan they have is going to work for them in 2017, because they can't really change it come January 1st. In January is probably the last time you can change your plan.
Sure.
So if you don't change it then you're pretty much stuck with what you have for the next 12 months.
Here's what I found to be different. It used to be if you don't want to change anything, you don't have to do anything, but then they changed it where even if you don't want to change anything, you have to go through and do it again, where you don't remember what you had before. Why did that change?
We get that a lot. So a lot of times our clients will call us up and say, okay, I don't want to do anything. What do I need to do? I said, well, here's a new rate. Are you okay with it? Yes. Then you don't have to do anything. So they just want to give you the opportunity to be able to know that it's going to change and allow you to make changes if you want to.
The rates going up. We heard a lot on the debate yesterday about Obamacare and the rates going up, this percent, that percent. Explain how much they're going up and why, if you can, for people.
Rates are going up anywhere from 0 to 30%, depending on the insurance company. Sharp and Kaiser and HealthNet had the lowest rate increases. Blue Cross and Blue Shield had the largest rate increases. So,
why?
From what I hear, again, we don't hear. What we were told is that the Blues underpriced the product for that. You know, Blue Shield, if you use Blue Shield, you're going to have a Scripps doctor. If you use Blue Cross, you're going to have some Sharp doctors and some UCSD doctors. What we're recommending to our clients is if you really want to use a Scripps network, HealthNet has an HMO plan that isn't having a big increase, maybe somewhere 4 to 20%. That would be an option for you. Or why don't you try Kaiser or Sharp for a year? We recommend that to all our clients. Try Kaiser, try Sharp, try it for a year. If you don't like it, we can always move you back. But that's an option for people who want to lower their cost and keep the same doctor.
Okay, so speaking of lowering your cost, and if you're just the layman out there trying to get their medical insurance, what options do I look at? Because it was very detailed for vision, for dental, for this kind of thing. And how do you know what you need and what you need to cut out for your new plan?
The best thing we recommend is sit down and talk to your health insurance agent. It costs you nothing to use a health insurance agent. The insurance companies pay us just like they pay the doctors in the hospital. We can sit down, evaluate what you're trying to accomplish, and tell you the best avenue for you.
That's the key. Ask a lot of questions.
Yes.
It used to be there were people that you can go to at your workplace to help you do all this. Now you got to do it all yourself, and it's confusing.
You do, and that's why the agents are there to help you and make it as easy as possible for you, and look at your situation and analyze it and ask you questions such as, are you going to have a surgery in the next 12 months? Are you taking a new med? Is there anything unexpected coming up? And if it is, then we can steer you into a plan that will give you more coverage. Or if you're going, look, I'm a 25-year-old healthy guy, I just want some coverage, we can put in a plan there that will cover you too.
Okay, quickly, one word answer to get. If you're on Medicare, do you need to do anything or are you good?
With Medicare, if you like your plan, your doctor's still taking Medicare, you're fine.
Okay.
If your prescription costs have really changed a lot this year, then you may want to look at your Part D prescription.
So we do nothing or do we still have to sign something?
Nope, do nothing.
Perfect. All right, Craig, stick around. We have questions for you after the show is over. We appreciate your time.
Thank you.
All right, my friend. 822.